welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication that's commonly used in diabetics. Its name is Metformin, and it has a brand name of Glucophage. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. So Metformin is an anti-hyperglycemic agent that improves glucose tolerance in patients with type 2 diabetes. It lowers both basal as well as postprandial glucose levels by decreasing hepatic glucose production as well as decreasing intestinal absorption. It improves glucose sensitivity by increasing peripheral glucose uptake and utilization. Metformin does not modify insulin secretion. So metformin is indicated to be used in type 2 diabetes mellitus, and one off-label use for metformin would be polycystic ovarian syndrome. Before somebody was to use metformin or glucophage, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Metformin is contraindicated in patients who have acute or chronic metabolic acidosis. This would include diabetic ketoacidosis with or without a coma. If an individual has a hypersensitivity to metformin, it would be contraindicated in them as well. It's also contraindicated in severe renal impairment, but I will say that when I was in school and we learned about this medication, some physicians would just choose to give a very low dose rather than removing the medication, as it is still beneficial for the patient. Patients in hypoxic states, such as cardiovascular shock, acute congestive heart failure, acute myocardial infarction, and other conditions characterized by hypoxemia would put the patient at an increased risk of experiencing lactic acidosis. The medication would have to be discontinued if this occurred. When patients are using metformin with insulin or insulin secretagogues, they would be at an increased risk of experiencing hypoglycemia. So when these medications are started, there should be close monitoring. Metformin must be discontinued at the time of or before any iodine contrast imaging is done if the patient who's getting this procedure done has a creatinine clearance below 30 and 60 mils per min, they have a history of liver disease, alcoholism, or heart failure. Hypoglycemia may happen in patients using metformin if they have insufficient calorie intake, if they're doing very strenuous exercise, or if they're using the medication with other hypoglycemic agents or alcohol. The risk of these situations would be increased in the elderly, debilitated population. Some people may experience a low vitamin B12 level. It should be avoided in patients who have a documented history of hepatic disease, as this would put them at an increased risk of lactic acidosis. Caution should be used as well in individuals using metformin who are undergoing surgery. This could put them at an increased risk of experiencing lactic acidosis, and as well, we should suspend the medication because food and fluids will be restricted during this time, and that can cause some issues in itself. Now, when somebody is cleared of the contraindications and they're made aware of the precautions and warnings, and they start using metformin or glucophage, they can expect to take this medication in tablet form. When somebody is just starting this medication, they can expect to take 500 milligrams twice daily or 850 milligrams once daily. The dose could then be adjusted by 500 milligrams every week or by 850 milligrams every 2 weeks. If desired, patients who have started off the medication on 500 milligrams twice daily do have the option to switch to 850 milligrams twice daily. This would typically be an option for them after about 2 weeks of therapy. Doses greater than 2,000 milligrams per day may be better tolerated for patients if they take them in 3 divided doses rather than 2. In terms of what dose patients will be stabilized on, this would depend on their sugar readings as well as the clinical experience of their physician. How successfully the patient tolerates the medication will be very important as well. If somebody is using metformin to treat that off-label indication that we mentioned earlier in the video, polycystic ovarian syndrome, they would use 1,500 or 2,000 milligrams per day in divided doses. When patients are actually taking their dose, they should take it with a meal. And if they're using an extended release version, they should not crush, chew, or alter the tablets in any way. They must be swallowed whole. Patients can expect to have their vitamin B12 levels monitored or checked every 2 to 3 years. And they'll also get tests to make sure that their kidney function is appropriate, as well as their A1C, which is an indicator of how well your blood sugar levels are staying under control. Now, as with all medications, there are some side effects that patients may experience while they're using metformin, so I'll list some of those side effects here for you now. Cobalamin deficiency happens in 7 to 17.4% of patients. Diarrhea happens 53% of the time when people use the standard immediate release formulation, and it can happen about 10% of the time when patients are using the extended release version. Flatulence happens about 12% of the time, and indigestion can happen to 7% of people. Malabsorption syndrome happens about 10% of the time. Nausea is seen in 7% of individuals, and vomiting can happen up to 25% of the time. 6% of patients experience a headache. Then some more serious but rare side effects would be that lactic acidosis as well as hepatitis. That's all we're going to talk about today with Metformin or Glucophage. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you're willing to help me grow this channel, you can do so by liking the videos, sharing the videos, and most importantly, subscribing to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.